Hi, my name is Letitia Peters, and I'm doing my evidence-based practice capstone project presentation. Let's get started. So when I chose my research question and my research topic, I wanted to do something that I was interested in and how I could help my community. I decided on STI prevention with a focus on chlamydia. My PICO's question is as follows. In adolescents and young adults with a focus on ages 14 to 30 years of age, is the chlamydia infection rate for those patients with healthcare providers who make testing and education a priority lower than those patients with healthcare providers who do not make it a priority? So let me give you a little bit of a background here. So I've been a nurse for almost 30 years. Chlamydia testing itself and attitudes regarding chlamydia have changed a little bit. It used to be that providers would care and make STI testing a priority and education a priority. Patients also practiced self-care. They limited the number of partners they had. They also took the time to get tested. They practiced safe sex practices. Well, health and sexual health has changed a little bit. It seems that patients have become apathetic, that they don't care if they get an STI and use safe sex practices as there's a pill for it. It seems that time is an issue for providers. They don't have the time to test. They don't have time to educate. Well, October 8th, 2019, the CDC notes positive chlamydia cases rose to 1.7 million. This in 2018. This was the most cases that were ever reported to the CDC. So this led me to choose my project. So with any type of research, it is important to do evidence-based research. Robinson 2021 notes there is a substantiated reason to use evidence-based research, as in research that is evidence-based is very validated, it's worthwhile, it's not unethical. So during evidence-based research, I found, for my topic, I found several underpinnings, and you look for underpinnings and themes. So my underpinnings were: one, education for providers. If that's increased, so does patient testing for chlamydia. Two, education and testing for patients was lacking. Three, educations and guidelines regarding STIs and chlamydia was lacking. The themes that I noticed were, well, they centered around chlamydia, they centered around education for providers and patients, and it also centered around provider attitudes regarding education for chlamydia and testing for chlamydia. Rose et al. 2017 notes a study in which 18% of patients retested for chlamydia were still positive. Noting these figures were indicative of many issues, which is: one, lack of importance on the subject, lack of awareness on the subject, and also noting the importance, because of these things, to implement strategies to change practice and to increase chlamydia testing. Heitman et al. 2017 identified a study in which 62 providers, 12% of those providers indicated they needed increased education on reproductive health, which included STI testing. So with chlamydia, there's definite need in testing, there's definite need in education, and there's definite need in the change of attitude towards both of these. We need to realize how important this is. So with any education, any type of project you want to get through, you want to do an analysis of your stakeholders. So you also want to do a communication analysis of your stakeholders. So this is super important, as you need to know what types of people you're dealing with, what people are going to be motivators, what people are going to challenge your project, what people, thank goodness, are going to be facilitators of your project. We also need to know that it is critical in order to work with people to do a communication analysis, because your different stakeholders have different needs. They need encouragement, and they need to be involved, they need to be informed, but they also have unique needs. So it is important to note that if you communicate effectively, you're going to have happy and satisfied stakeholders. So we did a case study, and this case study involved groups of people. So there were nurse and provider teams that were studied, and patients were studied in this 2-week period. The patients either had to be a person that was there for their GYI exam, a person that was either a new patient, or a person that was a new OB. And all of these types of people need chlamydia tested. Well, nurse-led testing yielded better results. We had results of testing of 36% and 60%. So providers were 25%, 25%, and 33%. Our clinic overall needs major improvement. We were only at 34% testing for chlamydia and other STIs for these patients. Totally need improvement. So with any project, we need quality improvement. So the Barrow et al. 2021 notes that CDC, after reviewing current practices and reviewing guidelines and practice indicators from experts in the field, they developed new guidelines for providers, and these new guidelines included increasing and the autonomy for nurses, letting them have standing orders and nurse visits to improve chlamydia testing. So with our clinic, we are working on doing a poster and a handout for education, and we also are looking at doing guideline changes so that we can allow our nurses to help improve this number in chlamydia testing. MEC 2017 notes that if you allow nurses to do evidence-based nursing, it allows them to practice to the extent of their licenses and their education, helping to reduce the number of chlamydia positivity tests, and allows the nurses to engage at a point that it will help to improve these numbers. So with all quality improvement projects, we must do a plan, do, study, act. So we planned what we were going to do. We're going to implement the changes. And then later, unfortunately, long after this course is done, I'm going to check to see if these interventions have worked. If they have not, we'll go back to the drawing board. So in conclusion, we do think with these changes, we are going to make a difference in our community and reduce the numbers of chlamydia. So 1 in 5 people, the CDC 2019 notes, 1 in 5 people in the United States is positive for chlamydia. So if we can make a difference in our own practice and in our community, then maybe we can make a practice by sharing these with everyone. We can make a difference in our community, statewide, nationwide, and our world as a whole. Thank you so much for listening to my presentation.